Hey everyone, today we're going to be learning the role of Arestin in periodontal treatment. Now let's break this down. We know that a tooth has three layers. The outer layer, which is solid white, the inner layer, which is yellow, and the nerve, which is red. So the first layer, the second layer, and the third layer. Now the third layer runs down through the roots of teeth. These are your roots. They're embedded deeply within your bone. This right here is your bone that supports your tooth, so that as you're chewing, the tooth does not move. The gum is supposed to sit over the bone, protecting both the bone and the tooth, and in a healthy environment, you're supposed to have no space between the tooth and the gum. However, when you have an infection by bacteria, bacteria tend to sit by the gums and release toxins and create this space between the tooth and the gum. This space has a fancy name. It's called a periodontal pocket. Now, most dentists use what's called a periodontal probe or a ruler to check how deep your gums are. Now, here's a cheat sheet, a chart that tells you what's healthy, what's not. If you look very carefully, pockets from 1 to 3 are considered very healthy, and anything above that is considered not healthy, and you have to act on it to do something about it. Now, if you look carefully, the probe here, or a periodontal probe or ruler, checks from the top of the gum to the base of the gum the depth of the pocket. Now, once you find out that the gums are about 5, 6, or 7 millimeters, that's when you need to do what's called a deep cleaning. Now, most of you are going to say, hey, I go to the dentist, I get my cleaning once every 6 months. What do you mean? I never heard of a deep cleaning. Or some of you might say, yes, my dentist mentioned something about a deep cleaning. I have no idea. Well, let me explain. Every 6 months, you get a cleaning above the gums. That's this zone right here. If you have gum problems, which means you have deep pockets such as 5 millimeters, 6, 7 or more, that's when you need a cleaning under the gums. That's what a deep cleaning is. And it's diagnosed or found out with this instrument called a periodontal probe, or also known as a ruler for simplicity purposes. Let's go dive back into the video. Now, Arestin is a special antibiotic which we'll learn about, and it's used in the treatment of gum disease, or a fancy name is called periodontal disease. Perio meaning around the tooth, dental means tooth. So let's begin. So we know that for many millions of people, the tooth structures are the same, and what we have is a combination of bacteria mixed with debris by the gums. And when you brush, you remove most of it. However, the thing that we never notice is for those of us who cannot clear the bacteria due to genetics or other problems, which we'll talk about in the later videos, you get debris, which is the yellowish part, or plaque we call it in the dental field, mixed with bacteria, which is this bluish part under the gums. And this is something that your brush cannot reach. Now, if you look carefully and you zoom in microscopically, you could see that there's different bacteria that sit there. This is just to name a few bacteria. And as these bacteria sit in the area, what they do is they start multiplying. And as they multiply, they move from the gum and fuse deeply into the tissues. So they move from the gum area and the tooth area, and they start causing an inflammatory response. Now, this inflammatory response is a release of cells from your vessels. Bacteria is coming in. Your body's trying to fight it off. These are white blood cells. These are your vessels. This is your bone that supports the tooth. This is your tooth. This is the space between the gums and your tooth, and this is bacteria multiplying. You create this inflammatory response and you get a swelling, your gums tend to bleed, and this is what's the foundation of gum disease, and your gums start moving away and the space gets deeper. Now, There's a special treatment called deep cleaning, which we just covered. A fancy name for that deep cleaning is called scaling and root planing. And there's an antibiotic called Arestin that's used to fight gum disease. Now here it says when indicated, use comprehensive treatment. That means a combination of treatments, including SRP, which is scaling, S, root, R, P for planing, and Arestin, which is antibiotic. Now, what happens is when you're doing a deep cleaning, it's really tough to remove all the debris and the bacteria. It's nearly impossible to remove the bacteria with just an instrument. And the bacteria in a short time frame get back to the baseline. They keep growing and they multiply, and the process continues. Now, what we indicate is a deep cleaning, or most dentists do, mixed with an antibiotic called Arestin. Now, Arestin is a specialized drug that gets delivered straight only to the dental team, to the dental office. It's delivered in this little delivery system with a syringe. It's actually a powder form, and you could take a quick look over here as the next scene. The powder goes into the gums, not an injection, it's just placed there gently. There's minimal to no discomfort, and it's actually delivered or deposited.